What's up, y'all, and welcome back to my channel. Welcome to day 4 of 10 days of medical assisting. I know y'all saw the title of this video, and I know y'all are probably ready to hear what I am going to say, because baby, I've been a medical assistant thus far, and I have had some great moments. I've had some crazy moments. I've had some very rewarding moments, and today we're going to talk about the crazy. So, if you guys are interested in hearing about my crazy experiences as a medical assistant, go ahead and keep on watching. Make sure you smash that like button and look around on my channel. If you like what you see, then go ahead and subscribe. Alright, you guys, let's go ahead and get into some of my crazy moments as a medical assistant. So you all know that after I got my medical assistant certification, the job that I did immediately following me getting my certification was COVID-19 response. So I immunized patients. I gave COVID-19 vaccinations. I've given Pfizer, I've given J&J. I've never given the Moderna, but I did give Pfizer and J&J. I also dosed and diluted vaccines. I drew up vaccines a lot because my medical assistant certification, dosing and diluting vaccines, is in my scope of practice. I also gave COVID tests, and I managed and read COVID-19 tests as well. And also was a clinical site leader, so I managed and oversaw clinical vaccination sites as a medical assistant. So this crazy moment in particular happened while I was immunizing, and y'all, it was in the moment, it was like, oh, what is going on? But afterwards I was like, okay, that wasn't that bad. But okay, so basically this is what happened. Let's go ahead and rewind. So I go in for just a regular shift. Like, I'm giving vaccinations. I normally would give like a couple of hundred vaccinations a shift or whatever. So this particular day I come in and I sit down at my station and I'm vaccinating. I'm talking to people. I love talking to people, y'all. That is probably the best part of my job. Is just like how many people I was able to talk to and get to know, and help them feel more comfortable about the vaccine, and just, all these things. I was able to interact with so many different people, and I'm a person that likes talking to people. I don't talk about cookie cutter things. I don't talk about surface level things. I like to really get in deep so that people know that I actually genuinely care, because I do. I care about what people are doing with their day, with their life. So it was just one of them days. I was talking to people, vaccinating them, and this man comes and he sits down in my chair. And we ask the typical COVID screening questions. Have you been in contact with anybody who's had COVID in the last 14 days? Have you had COVID in the past 14 days? Are you pregnant? Do you have any allergies? Things like that. All the screening questions that we typically ask before we stick a patient. And I get to the allergies. He doesn't say anything. He doesn't tell me he's on any medications that we need to know about. Everything's just good. He says he's good. He doesn't have anything going on. He should be good to go with his vaccine. So I'm like, great. I finished screening him. We go ahead and get done with that. I hand sanitize, put my gloves on. I'm getting ready to stick him with Pfizer is what we were given at that point. And he is just sitting there. He's very relaxed. And I get the alcohol swab out, you know, I'm cleaning the area, and then I go to stick this man in his deltoid muscle. It was the left side. Yeah, it was the left arm. And he squirts blood all over my scrubs. All over my scrubs. And I'm sitting here thinking, like, what the heck? But the craziest thing about it was he didn't even flinch. Like, he didn't even notice, which people don't generally notice, because shots, especially one as small as the Pfizer, they kind of just feel like a pinch. So of course I didn't think he was gonna just like really notice that much, but I thought the blood literally squirting on me would at least catch his attention a little bit. So at this point I'm like, what the heck? Like, the blood didn't get on my skin, it didn't get, you know, on my face, it didn't get anywhere on me, it just went straight to the scrubs. And when I say the blood squirted, it wasn't like none of that, but it was like, you know, it caught me off guard. It was just like a fast squirt of blood. Like, I stuck the needle in and it kind of was like back at you, like, type of thing. So, and he didn't even really just notice. But then I think toward the end he kind of started to notice the blood, because, you know, obviously I had to clean it up. Like, it was kind of dripping down him and everything like that. So I think he started to notice toward the end. And he said, oh yeah, I forgot to tell you I am on blood thinners. Thanks for letting me know. Thanks for letting me know, sir. So it was a really, really funny moment, because, you know, blood thinners, they are supposed to help blood move more freely throughout your body. They keep you from getting blood clots. So people who are on blood thinners, they are gonna bleed a lot more than, you know, the typical person who's not on blood thinners would. So any minor cut, any minor puncture is gonna cause, you know, a lot more bleeding than what, you know, it normally would. So when he told me that, I was like, oh, okay. It's like I could, you know, I could kind of tell based on how you were squirting back at me. And he was like, yeah, you know, he was laughing. He was like, it just totally slipped my mind. And, you know, it was fine. I got him cleaned up and all that stuff. But it was just the initial, like, he just, like, squirted at me. His blood just squirted back at me. It was that initial shock of, like, what in the heck? But that would make sense that he was on blood thinners, because, you know, those things happen a lot. Typically people would just tell us, you know, I'm on blood thinners, just want to let you know, probably gonna bleed a whole lot, and then we can take measures, you know, to be prepared for when that blood comes. But me, typically I have clean shots. I don't get any blood. So you have the stuff next to you, but you don't necessarily have to just be as prepared and on guard, you know, when it's just a normal person who's not on blood thinners at all, because more than likely, if you're doing the shot correctly, they're not gonna bleed. So yeah, it just caught me off guard. It was a lot. it was definitely a lot, but it was an experience, I guess we could say. An experience. We both laughed about it though, and it was fine. So that was my craziest moment giving COVID shots. Yeah, that I can't even remember. I would like to have seen the look on my face after that happened, just for laughs, just to see what I look like. Of course, in that moment, whenever you're in a professional environment, like, you just immediately think, oh, you know, I'm gonna clean it up. Like, so I didn't stop doing what I was doing. I just immediately went to go, you know, take care of it. But I would have liked to see my face and what I look like when I was looking down at this blood on my scrubs. So yeah, you guys, that was definitely one of the craziest moments. If you are a newly certified medical assistant on my channel, which I know a lot of y'all are, because a lot of y'all have told me that y'all passed your certification exams and are moving on to the workforce, remember that if you are going to be giving anybody a vaccine, ask them if they are on blood thinners, and if they are, you need to have the necessary supplies next to you to be able to clean up the mess. So that is just a little pro tip for anybody who is about to be starting their medical assistant journey soon. So yeah, you guys, that's all I have for you. That was my craziest moment. Make sure you hit the like button if you like this video. Subscribe to my channel if you look around and like what you see. And I'll see you guys back here tomorrow. XOXO.